Thank you. Good evening. So I'm still at the office. I meant to do this from home, but like you guys, I'm full-time private practice, and I saw late emergency right up until we were about to start. So yeah, like BJ said, I work with Cameo Dental Specialist. I'm full-time private practice. I went to UIC for both undergrad or general dentistry and for endo. I'm a part of the Edgar D. Coolidge Endodontic Study Club, which if you're ever in town, especially during the midwinter meeting, come join us for an event. It's a great study club, one of the founding endo study clubs in the country. A big part of Sales Study Club, and I'm board certified. So, my relationship with Biomed Avalon goes back really back to college. BJ and I went to college together, and I've known Mike since he was a rep for a different company, so since residency. So they're an awesome group of guys. I trust them. And when they kind of start talking to me about looking at the file system that they had, it was an instant yes for me. And we've developed a great relationship. They help support. I like talking about dental traumatology, teaching that and saving teeth. And so they've been great advocates for me for helping me share that message. And I thank them for that. So whether you know Biomed or you don't, they really started out in the bioceramics market and their sealers, putties, using for surgery, perf repairs, and they got into the file market back, I believe, in 2022. And that's about the time, maybe the end of 22, 23, that I was kind of exposed to their files when I was kind of looking to change my shape and what I was doing. I was changing my irrigation protocol, which allowed me to kind of change my shape. And so even though this talk is mainly on reciprocation, I'm going to start out kind of talking about the cases you see. I use this NeoSealer Easy Flow. It's awesome. I really like it. These tips are amazing, especially working back in upper second molars and delivering the sealer down further into the canal. They definitely have less waste, but the product I've used now for long enough that I could advocate for it. And like I said, if you look at it, it has a higher cement content per gram, which to me is a favorable thing. And from a cost perspective, I can tell you that there's a really nice cost savings there, somewhere between 23 and 46%. So if you've never tried it, I would definitely try it, but it is a sealer that you'll see in the cases that I'm going to show tonight. So the objective tonight are one, we're going to talk about a little about the rationale between for using reciprocation and Excalibur Pro series and how it went from Excalibur to Excalibur Pro. We'll kind of talk about that system with traditional rotary, which I use forever. And we'll talk about some techniques that maybe enhance that file system. A lot of people want a one file system, and we'll talk about why I think, helping that file out beforehand matters. And then we'll talk about some cases and show some cases at the end. So reciprocation isn't new. It's been around for a very long time. When I took classic lit with Dr. Chris Wankis at UIC, we went through these things. It goes back to the micro mega balanced force technique, which was, if you don't know anything about that, balanced force technique is actually a stainless steel file technique, can files, and it was great for using it in curved canals from back in the day. And so you could see 1985. But as this system projects and the physics of how that works with reciprocation or going counterclockwise, clockwise, and how that acts on the dentin to remove it is really moved forward. Wave one in 2010 was a big step, and then Wave one gold and Reciproc blue and Excalibur, and now Excalibur Pro series. And so, I think back in 2014 when I first started using reciprocation, a guy named Marty Smith kind of opened me up to that, and I was kind of against it because I always heard, it kind of was like it's for general dentists, and I didn't really. I was like, why? Why would that be a bad thing? Why would something that takes less time, has less fractures or instrument separations, so it has a higher resistance to cyclic fatigue, less transportation or ledges, and has been at least shown to be at least even or better than a hybrid technique, meaning a hand file and a rotary technique. So as an endodontist, it just made sense to me when I started using it. And more than half of the endodontists in our practice, we have, I think, 11 endodontists here, and over half of them do use reciprocation. So reciprocation, these files, it can extend the lifespan of that file. It provides, for me, the shape back then I was looking for, I was trying to match what I wanted that final obturation to look for, right? Because the obturation is just a reflection of our preparation. And so it kind of fell into wave one gold at that time. And that's what I started out with. And, it's the cleanliness of the canal, what you're removing is shown to be equal or the same as traditional rotary. There were papers that were out that were saying that reciprocation might cause more micro cracks in the tooth. And what it's turned out is that's not true, that there's no difference between reciprocation and a rotary. That has to do with sometimes with the pitch or the taper of the file. But again, if you've never used it for actually removal of gutta percha, I have to thank one of the endodontists in our practice, Patrick Clark. He was the one who, my assistant told me, I was trying to get some gutta percha out. And she's like, hey, why don't you use one of your Excalibur Pros or Excalibur files? And I did. So if you've never used it for that, it's actually very effective. But for me, I've had this slide and I don't know who shared it with me years ago, but it kind of hits home. So I'm 51 years old. I have 11 crowns, two root canals, one's been retreated. And if I look at my dad's mouth and my uncle's mouth and I see, I had a series of cavities that went into class one, class two restorations, which developed into crowns and then root canals. And what I don't want to end up with is under a forceps, right? I don't really want to get an implant if I could keep my natural tooth. And so Dr. Kirk Corey, a good friend of mine, has this one. I saw this slide in one of his lectures and I thought it was awesome. It really made me think, this is really how my two maxillary first molars look. They're propped with Pro Taper Gold, probably went to the blue. So, a very large preparation. And the slide shows is, endodontics reimagined, right? Going from that first picture we took, if you look on the left, probably a more contemporary type preparation, and that root canal on the right, number 30, going to be a very smaller kind of ultra preparation, right? And so as we're getting to these smaller shapes, what I want are minimally invasive endodontics and trying to keep that pericervical dentin. If I can even just change my taper of the file, 10 or 20% to preserve that, I'm going to do that. I want to see that smaller shape. And, when you're using minimally invasive endodontics, when I make that jump, for me, it was GentleWave that kind of moved me there. And, there's a lot of different ways to do it. We're not going to talk about that. But all I would say is if you're going to get down to these smaller shapes, you got to keep in account that, the game is in the apical one third. We know that. Anyone can clean the coronal middle one third of a canal. But getting on the apical one third, that was always why we made these large preparations. And so, Dr. Scott had showed, I asked him to share some cases because he's like one extreme, right? Like the ultra marathoner. He's doing very minimal instrumentation, maximum irrigation, big general wave practice. They do some awesome stuff. If you don't follow them on Instagram, you should. But they present some really cool stuff. And I think it's important to look at that because that's, one extreme. And eventually, who knows, maybe we'll all be doing root canals like this. But if you're going to try to get to that smaller shape, for me, I'll use nano shapers. Okay. And again, not part of tonight. This is a rotary system, but if you're kind of into that ultra small preparation, these are some great files. These are some cases that Kurt shared and, and I've used them and they're great. But for me, this case I posted a while back, and the reason why I did it was, um, it was two root canal that were both done at Cameo. One of them was done by one of my colleagues, and that's on tooth number 13. A much more classic preparation, larger master apical file size, a very nice looking root canal, but a little bit larger preparation than the tooth number 12 that I did at that time. Now, I didn't use gentle wave on this case. I just used a sonic irrigation with full strength hypochlorite and EDTA, but again, a smaller prep. And I finished this with an Excalibur small, which is an E20. So that's a 20 tip, 5% taper. And that was after I used a ZS1, ZS2. So I used a total of three rotary instruments with irrigation. And this is the kind of shape that I would say is more contemporary, right? The shape on the right's a little bit bigger than I want to be, probably more classic. And so I think this is the kind of shape, if you like that, that Excalibur really comes in and really shines. And so if we look at what, like I said, Wave 1 Gold, which is where I started, and at the time in 2014, it was a great file. But if you look where it's at D16, it's 1.2 millimeters, right? It's a very large shape. So if you're dealing with a long tooth, 23 millimeters, and you're getting that all the way down, you're taking away a lot of that pericervical dentin that may predispose these teeth to fracture. And this is one of the first cases I ever did with GentleWave. I put it in here not because it's this outstanding case. It's just a case that I did. And the reason why I used it with GentleWave is that if you look in that mid-palatal root, I saw this calcification on the cone beam that I took pre-op. Tried to get around it, really wasn't getting around TAMP files, ran GeneWave, it was gone. There's a axial section, and that's the final product. And so, it was finished with wave one, and it's a great shape. It's a primary wave one, but again, probably a little larger than I want. If I was to do that same case with an Excalibur Pro, it's 25, E25. That's a 25 tip, but just has less taper. It's a 5% taper. And so for me, if I have that longer tooth where I'm going to be putting that, getting all the way to D16 in the canal, I'm saving some of that pericervical dentin. So these files are great for that. And this is more of the shape that I'm doing now. If you're looking, this is what I like, this is what I'm doing. Whether I'm using GeneWave or I'm using any form of activated irrigation, this is kind of more what I'm looking at. And this was finished with that E25 file. So comparing side by side, you can see there's about a 20% reduction at D16. And that's just because less taper. Same master apical file size, but just less taper. And I think we could do that now with multiple irrigation systems that are available. So if we look at objectives on instrumentation, why do you pick a file? One, we pick it because it's easy to use, it's efficient, it has a low separation risk, right? So it's going to be resistant to cyclic fatigue, torsional stress, and I say minimal instrumentation because, I'm, like I said, a full-time clinician. Every time I have to take my eyes off the microscope to change my file. Yes, I could have my assistant do it, but I don't, maybe I'm a control freak or don't trust them. I always set my own stoppers. So every time I look away, I'm getting more eye fatigue. Okay, my neck's getting under more stress. And if you think about how many patients you see in a day, in a week, in a month, and you add all that up, it's going to create more pain, more stress in your neck. So to me, if I can minimize my instrumentation, how many times I have to look and change my stopper and change files in the long run of my career, it matters. And again, I think cost should always be a factor. If you're getting the same or better metallurgy and coatings than what you have now, and it's less expensive, well, those are three wins. So if you look at this slide, I use almost all these files. Like I said, I was in residency in 2021 or 2001 to 2003. So we were using at that time GT series. My dad was still using series 29, if you remember those. I bet we used Quantex. And when I was moonlighting, I would use any free file that a rep gave me. So it gave me a great opportunity to use a ton of different files. And when you use a lot of different files, you learn a lot, right? You get to look at a file and you could say, okay, what's the diameter? What's the taper? What kind of metal is it? Is it rotation? Now is it reciprocation? And then you look at the case and say, how long are the canals? What's the curvature? There's that curvature that's, obviously we're not seeing that's unappreciated in the buccal paddle direction or buccal lingual direction. And so all those things for me are going to factor into what file I'm going to grab or what I want to use. And back then, that really did matter. I remember Scott Bankover telling me, you should be envisioning your file, what it's doing in the canal. And to be quite honest, with the files that are available today, you don't have to think as much. They're that efficient. The separation risk is that so much decreased that it's really made our job so much better. And so change is good, and it's necessary, but it can be hard. I kind of say like, if you're changing file systems, it's like watching a high school kid change their girlfriend or boyfriend. It's this big deal, right? It's a comfort zone you're used to. You're used to kind of doing something a certain way, and it can be hard to change. Even your assistants could be an obstruction to change because maybe you have a stock of files or whatever, and it's hard to kind of throw sand in the gears. But when we look at like why a lot of these files, why are they at 20 or 25? Um, Back then, when 2001, 2003, if you weren't prepping to a 30, 3506 and the mesial buccal, and then your MB1 or your mesial canal of your lower molar, people kind of looked at least at UIC, kind of shamed you for it. Like you weren't opening things big enough. But now we know, if you look at these studies on anatomy and apical constriction size, mandibular molars, you're looking at a 20 to a 26 maxillary mesiobuccal roots and distal buccals, kind of an 18 to a 25. And on the palatal roots, a 22 to a 29. So, besides the distal root, single distal root on a lower molar, most of the apical constrictions you're looking at are going to fall into this range. And if we look at some studies, we know that keeping a more narrow apical stop, it's going to prevent debris from going out. It's going to prevent, some type of irrigation issues, less transportation. And if you look at, this older study, from even from 94 from Yard, they compared a master apical file of a 25 to a 40. They did treat these with calcium hydroxide, but they found is there was no significant difference in bacterial removal. We know that these files, even if it says it's a 26, that's not a perfect circle. Okay, that apical constriction is not perfectly round. So we know that. We know we're not going to touch all the walls of a canal. Every study's shown that. So because of that, we have to rely on irrigation. So keeping that smaller master apical file size now, to me, isn't so wild. And so looking at reciprocation, this is what that file is doing in the canal. As it's going down, it's going counterclockwise, clockwise. And so if you can envision that compared to a rotary file, it's not just spinning where the tip's gonna catch and the file's gonna keep spinning, it's gonna snap off, right? That torsional fracture. It's gonna increase resistance to cyclic fatigue, which I talked about, but it's really increasing efficiency with less transportation. And like I said, it does help moving gutta percha. And so when I look at cases again, that radius of curvature is so important, right? If it's a long, let's say it's a 70-degree curve, but it's a nice 70-degree curve, that's not so bad. Almost like skiing, right? You could take that down. But if you have a very sharp radius of curvature, that puts more stress on the file. And so think about that when you look at, and that's why I like a glide path. People advocate, I know with reciproc, we don't have to use a glide path, the file will go right down. And I've tried it just to see what they were talking about. And yes, you can do it. You can do the same thing with Excalibur files. But why do I want to put my file under that much stress to do it? It took me longer and a lot more passes to do it. Where if I create a good glide path, and all of these files are great for glide path files. On the left, you have path files. Use them forever. To me, completely outdated. You can get the same thing with using a Z Evo glider than you can get with using the three path files on the left. My other go-to is just using my typical slim shaper. Okay, so using my ES1 slim shaper, that's usually my glide path file. It's a 15 tip, 04 taper. And then on the right, there's several other options. Wave One Gold glider, I literally probably did 10,000 cases with it, um, but kind of moved on. And so we have a new glider in the middle we'll talk about, and that's Excalibur Pro glider, which has come out. I'll be upfront and honest, my experience with it is only for the last really 6 weeks. So I haven't done, 1,000 cases with it to really tell you how great it is. But what I've seen so far, it does look really great. And so, even though this isn't reciprocation, this is still when I have tight, small canals and I need a good glide path, Z Glider Evo is really what I use. And just to prove it, this is an early case I did. I'm just going to show you two cases where I thought they were pretty difficult. One of which was the first case, and this was one I did probably, I don't know, in the first 50 cases, but this was finished with an Excalibur Pro 20. And you can see nice curvatures, maintains those curves. Obviously, there's a buccal palatal curve we're not appreciating, so there's definitely an S curve going on here in more than one dimension. Um, I think the general wave picked up that accessory canal into that lesion, which is nice. And here it is at recall. I just had the patient come back after they had it crowned, and things look good. So, again, if you've never tried the Z Glider Evo, it is my main path file for difficult cases. And this is honestly the first case I ever tried it with. Literally, BJ had dropped it off and told me to try it. I didn't have a lot of them. I was looking for a hard case. This case to me looked really hard, and I used it. And when I tell you that, I went to an 8 hand file, a C file 8, 2 length to grab a quick working length, and then went to this, and it was amazing. I think probably got the length in 3 passes. So it's a very efficient file, but again, it's running at 500 RPM. And I know a lot of people get nervous about that, but the file does run better and work more efficiently at that speed, in my opinion, and what the company advocates. So, what's new? Well, we're going to look at this video. Now, on my end, there's music going along with that. But obviously, this is a commercial video that's being used by Biomed Avalon. And what that's showing you is this nano coating that they put on Excalibur. So from Excalibur to Excalibur Pro, they changed the metal a little bit and they put this nano coating on the file. And it's still the same reciprocation. It's still the same tip size. But it has a different tip on it. So they have adjusted the tip, but it's the same tip size. And the flutes and the way that the file is designed is still the same. It's just the metals changed and the coatings changed. And again, they'll talk about it as being a single file system, which I think, in reality it can be. It just depends on the tooth you're working in. So looking at Excalibur, just the original Excalibur reciprocating file system, if you've never seen it, this is what it looks like. There's four different files. The tips go from a 20 to a 25 to a 35 to a 45. Now, in all transparency, I've probably only used a 45, maybe 15, 20 times. I don't see a lot of those cases. I wish I did. If my referrals want to send them, I'll take them all day, but I just don't see a lot of them. The E35 is a file that I do use a little bit more. But again, usually that's one where it's a single file system. It's a bicuspid, fairly large, it gets right down anteriors, but it's a very efficient and very effective file. But the two I use most often are the E20 and E25. So this is how it looks. You could see the 5% taper in the tip size, and the maximum flute diameter here is going to be the same with Excalibur Pro. And so using Excalibur, this was the case that I did, fairly early on. And I wanted to see like, what could these files do? Can they maintain S curves in difficult cases? And again, this would be a pretty difficult case to do. But it would work so easy and so well with neocellular flow that I was like, okay, these are definitely something that I can do. And I'm going to start. So if you look at now the Pro series, they have this kind of rainbow look to the metal. And I'm told that has to do with how the metal is heat treated or how it's treated, and then how it's sprayed with that nano coating. So again, a little bit different look. I could see right away if my team, my assistant hands me, a Pro series and a non-Pro series, because we have a ton of files here, so we're still kind of getting through our regular Excaliburs before we use all Pros. But it's a counterclockwise 150 degree followed by a clockwise 30. And so that's how the instrument is rotating as it goes down. The nano coating, I think, is really cool. When you're looking at a file, why should I use it? This is new technology, right? I mean, as technology gets better, it's going to make us better. And if I can make my job easier, I'm going to use it. And so again, it's just something that they've done. It's making these files more efficient with the same flexibility, okay, corrosion resistant, and it helps keep that sharpness there. And these files do come 6 files to a pack, and then the glider comes 3. This is that new tip design, like I said, and I asked a little bit about it to talk. If you really want to get into the details with the engineers, I'm sure that they can get you with that. But they basically say that it's just a little more optimized tip geometry that's going to be a little more aggressive. And I have found that that is the case, especially if you're using less of a glide path. So it seems to work. So again, you have this nano coating. It's helping you increase more cyclic fatigue resistance compared to the previous file, preventing corrosion. Again, I'm a single use guy, so when I use these files once, I do get rid of them. People who may reuse files that may work from a corrosion resistant standpoint, lasting sharpness. Again, I like using files once because when I use them once, they're the sharpest they're going to be and they're more efficient. The more you use a file, the more it gets disinfected or gets sterilized, the more likely that it's going to lose its sharpness. And if you look at the literature, it goes whether it's rotary or reciprocation, files do become duller as they are used and as they are sterilized. And then the biggest thing for me is maintaining flexibility. And one of the cool things, which I'll show you in a video, that these Excaliburs have is they have controlled memory. So you can really bend them when you're working in real tight spaces. And I'll show you a video of a case I just did. And again, Wave 1 is a single-use file. That's why you can't reuse them. These files do not have that on the handle. And again, just another case to show you where kind of put this file to the test to see what it can do and literally delivered beautifully. So it's just a nice shape. These are built both cases that I pulled out of Kirk and I did at the Vision Summit. We kind of were showing different files that are available, and new technology that's out there. And so I was able to show Excalibur Pro. We just gotten our hands on them and just kind of, it was an early, we had a few files that we got before the launch. But when you look at this, just because to show you that on top you have this, if you're going to stick with all reciprocation, you can use this Excalibur Glider Pro on top. Now, again, 4% taper. So it's going to give you a little more taper than that Z Glider Evo at 3%, but still at a 15 tip. So it probably would be more applicable to really the Slim Shaper ES1 in terms of the shape you're going to get for a glide path. But again, if you're sticking with all reciprocation, it flows really nice into this, depending where you want to finish. Most people, according to sales, 85% of people are finishing with an E25. So that's just based on, I think, their sales information. And this is how it looks with the shank. I still use the rubber stopper, so I don't really use the depth marks. They're nice. I know people that use them, kind of like implants, implant when you're measuring. I mean, it's nice to have those on there, but like I said, I don't use them. But if you're going to follow through, like in how your sequence would be, if you're just using reciprocation, this is what it is. Whether you're using a K file or a C file doesn't really matter. But irrigating, recapitulating, we have residents on this Zoom, we have general dentists on this Zoom, we have educators on this Zoom, endodontists on this Zoom. So there's a lot of different people on the Zoom. So I'm trying to cover kind of a lot of different ways that you would do this. But if you're looking at it from how you would go through, you'd be recapitulating between files and irrigating. But that's a sequence of files you would use until you're comfortable with your shape. Now, if you're comparing, I think it's important to look at, how we compare apples to apples, the main guys out there, right? We have Excalibur Pro E25. We have Reciproc 25, right? So Reciproc Blue 25, same tip. And then Wave 1 Gold Primary, which is a 25 tip. So again, different tapers there. The reciproc file at even at D16 is going to be more conservative than the Wave 1 Gold Primary. But reciproc, and if you talk to people at Dentsply, they'll tell you that, the different motors should be used. There's different settings apparently from Wave 1. I know some people will use the same motor they had with Wave 1. So again, whether you get that new motor or not, I've tried the new motor with reciproc, and it's a good file. But like I said, I think the technology that's come out with Excalibur Pro, I just think it's better, it's more current, and the advancement helps. And there's some, if you're looking at literature, there's new, whenever files come out, we have to look at benchtop literature for the most part. Going back to Gutman's, if you knew who he was and his belief on benchtop studies, their value is arguable, but they can show you that, at least in a benchtop study, looking at cyclic fatigue or torsional fatigue, between Excalibur, Wave 1, Reciproc, um, we know that Excalibur Pro definitely had a 32% increase in resistance. I'm not going to bore you to death with the materials study that's here. You can look it up for yourself and read it. But basically, they were just testing these files out to see how resistant they were to fracture. And their conclusion was basically that Reciproc Blue and Excalibur displayed superior resistance to cyclic fatigue compared to conventional systems. So when I tell you that these are very hard files to separate, it's true. I know a lot of heavy-handed people that can break a lot of files. And I'm on a scale of 1 to 10. If 10 is the heaviest handed, I probably fall more in that 7 range. But again, I think if you're using the Excalibur Pro series, that would be very hard to do. If you look at that study and their top performing systems, you'll see that this is regular Excalibur with Reciproc Blue. You'll see some of these files that probably these are what you guys are using nowadays, kind of falling away from the other ones. But again, it just supports the fact that if instrument separation is something that you do have a problem with, this is a file that could help with that. So, like I said, I used Wave 1 Gold for probably 8 years, 8 or 9 years. And when I look at, we talked about the shape, we talked about, why I like Excalibur design and that narrower at that pericervical area. But there's a huge expense difference, I can tell you, between Wave 1 Gold, Reciproc, and Excalibur Pro. And we'll kind of break that down. But, Well, I have a slide later on that'll break it down by how many come per pack and what the cost is. But for me, these are about $6 a piece. So I'm using roughly 3 or 4 files per case. And so for me, that cost is going to fall more in that $18 range for instruments, where, a $6 file, that's why I don't reuse them. People, when Wave One, I remember I first used them, they were like $25 a piece, $26 a piece, very expensive, even if we bought them in bulk. We have a pretty big practice, so we got really good pricing. But and those were at one visit. But now you're talking about at $6, it's a very inexpensive product, and you're getting great technology out of that. And so I have a couple videos in here that they supply with me. It's a great, I was trying to get videos to show you how these files look and how they curve and how we can compare them. And so take a look at this for a second. You compares Wave 1 Gold Small to the Excalibur Pro E20. So same tip size. Okay, we're going to look at is not a study. This is just how you would look with the Pro and how it bends. And it bends more than that. But what's nice about that is when you're trying to work in a tight space, that controlled memory, when you can pre-bend that file to get it in that canal, because I'm not using orifice openers anymore, right? So when we're trying to get a file into a canal and you're minimally preparing, you're not using gates fittings, you're not using an orifice opener, you know how tight that could be sometimes on number two. Trying to get into that mesiobuccal orifice an upper second molar on an older patient that's not fully reclined, and you can pre-bend this back, it just really makes life better. There's one more little push here, I think, to show. But if you really want to put a lot of pressure on them to see, it definitely holds its flexibility compared to its competition. Extra pressure there. And that's what I'm talking about. When you can see that 90-degree curve and it maintains it while you're trying to get that file into its position in the orifice, it just really, really helps out. And if we look at an Excalibur Pro E25 compared to a Reciproc Blue 25, just again, all we're looking here is can you grab that file? How flexible is it? How easy is it to bend? And does it hold its bend with that control memory? So that's still, the Reciproc is making a pretty good bend there. He's making a lot of effort to do that. But again, if we compare the same tip size and look at the difference. I mean, you're looking at greater than 90 degrees there, and it holds it. So again, to me that's important because it makes my life easy. Today I had several number twos, and I can tell you that one single thing would be one reason to just change. Now I'm going to go a little throwback to some classic lit here. My dad actually, one thing I have to correct BJ on. So my dad did not train at UIC. My uncle Ray trained at UIC, and my dad trained under Frank Wine at Loyola. So I don't know if my dad's on this. He may have jumped on, but and my dad and my uncle actually interesting. They both actually applied against each other for endo program. So my dad graduated dental school in '69, went to the military. This was during Vietnam. He got out. He worked a couple years. He reapplied. My uncle was applying at the same time. He went to UIC dental school. He was accepted by Dr. Ramikis, and my dad got accepted by Frank Wine. So it was kind of cool because they were very different programs in the same city and exposure to different things. But this is a very classic article talking about what a stainless steel file does when it's in a canal. And the reason why it's applicable to this lecture is because I'm going to show you this next video where we're going to be watching the difference between Excalibur Pro and Reciproc. And a reciproc is a stiffer file. It's a great file, but it is a stiffer file. And as that file is going through an extreme curve, I want you to watch where the tip is on that outer portion, okay, and the inner portion. And you're going to see it's just a natural, it's one problem we have with all files and canals. When we put a file in a curved canal, and the more curves it is, we know it's not going to touch all the walls. So take a look at this. It's an extreme situation. We'll start off with the Reciprox 25 at 7%. So now he keeps pretty good pressure holding it there. For me, that probably wouldn't maintain that pressure, whether it's on a tooth or a block, just worried because back in the day that would have fractured one. But you'll see as that file's going down the canal and as they're irrigating, especially when I get to the apical 1/3, I want you to watch. Here he is recapitulating. So now as it advances, you can see it's a little stiff and it has a pretty large taper there. So that's going to make it harder to get down. And as it encounters resistance at that curvature, but again, watch that last apical curve when they try to push that file to length. And here's a close-up of that. You'll see as it's getting pushed up. Now, now we're going to Excalibur Pro. So again, same tip size. So it's the same master apical file size. But watch how it maintains. But again, lesser taper, so it's going to be able to get further down quicker. So as it makes it there, see, oh, it's going to start getting close, but it's still working that outer wall until we get one more pass where we get. And here we should make it all the way home. There we go. So again, it maintains that all the way to length, and we're going to get a little closer view of that right there. Now, obviously, we wouldn't do that on a real patient. We don't ever want to go through the apical constriction and open it up that big. But the point to this is on this plastic block is just showing you, and he's holding it there at length in a lot longer period than I would. But again, it maintains that curve, and it does the less stiff and the less taper is going to make it easier to get there. And this is just a file I took yesterday just to kind of show I was working on upper second molar and why that control memory is nice on that tooth. If you look, you'll see, I've got it pre-bent and I'm just going to try to sneak it in there with the curve and it goes right in. And this I used an E20 before that and I used a path file and I'm at length in 3 passes. So it's a very effective file. It's very efficient with what it's did. And this is how it looks. There's a pre and post op on that case. And again, it's kind of just a bread and butter case, right? These are the cases as an endodontist you're doing all the time. But when a patient like the 94-year-old woman I saw today on tooth number 15, if they can't open, it can't lay back, it's very nice when you have that controlled memory. And so if we start really getting into, okay, let's compare, let's say you're using Reciproc Blue now, and you're thinking about Excalibur, why would I do it? Well, we talked about the increase in cutting efficiency, which means less recapitulation, right? Less looking away from the microscope, grabbing a hand file, going back in. The tip geometry increases penetration. I showed you the flexibility. It's great. So, better, safer, saving more dentin with the 5% taper versus 7. And the cost savings, like I'll show you in a bit, is a lot. Plus, you don't need a different motor. Now, these are 2 cases I did. They were actually a day apart. I don't see a lot of bicuspids. I wish I did. But I actually had Reciproc Blue in the office and I had Excalibur. This is not the Pro Series. It's just the regular Excalibur. But same size file, 25 tip. But if I'm looking at just shape, I'm comparing apples to apples. This is how I look. And again, to me, it's a little big, a little more like a classic prep compared to the case on the right, which is a little less taper, a little more conservative, a little more contemporary. And again, more the shape that I want. And that's just another case finish there. Um, yeah, some shaper pros with Excalibur, small or an E20 as a final shape. So again, how does that look? This case was done with GenoWave and just an upper molar too. So this is more the shape I'm using nowadays. It's something I find I'm very efficient with, I really like. And if we want to look at some cases by some other doctors, Dr. Professor Shannon Patel, Dr. Arman Ghazi, and then Dr. Paco de la Torre, those are very nice looking cases, maintaining curvature, nice shape, a little more in detail if you want to look. This is not my case again. This is from Dr. Ghazi, but he's using Excalibur Glider Pro, okay, as his glide path, and he's finishing this case with Excalibur Pro E25. Now he makes a point to say that there's no hand files used. So again, we know that Reciproc has articles out there saying you don't have to use that. You can use the same thing here if that's what you like to do. And he integrates his apex locator with his Z Evo motor. I just don't do that. I'm kind of old school. I'm going to use my 810 C file, get a working length estimated. I'm going to check it again, but I still use hand files. It's just how I was trained. When I was actually a resident, we had to do our first 6 months with hand files, and then we got to use rotary. And all of my undergrad was done with hand files. We did no rotary in undergrad. To me, it was a benefit. I'm glad that that happened to me because if I can get around ledges and do things that I can see some other doctors can't do. But it was a lot of work. I can tell you that much. And then I think this is a beautiful case by Dr. Ghazi. You could see that nice, again, nice S curve in that mesial buccal root, but we know that there's another curve in that buccal palatal direction that's underappreciated. So that file's under kind of being turned like a corkscrew as it's going in there, and it's got to maintain that, which puts it under a lot of cyclic fatigue, right? That file, as it's going through there, is putting a lot of pressure on it. But again, this one was finished with an Excalibur Pro E20. No hand files used with the EZevo or Z Evo motor with the integrated apex locator. And then you can see his irrigation using 2.5% sodium hypochlorite with the Z activator. Again, activated irrigation, we know that's amazing. And then he finishes it off with 5% hypochlorite and a final saline rinse. And again, this is just another beautiful shape here. I don't know what this is finished with, but I would guess it probably was finished with more the E25. No lower molar. And so again, change is good. Now, if we start looking at the money part, we're going to kind of close with that. There's a lot of information on this slide. And, I'm not sure how many root canals each one of you does. If you're an endo and you do root canals all day, are you doing 3, 6, 8, 10? I know there's some guys out there that do 12 root canals a day. I mean, they're machines. But if you want to look at the cost savings, if you compare Excalibur Pro on the top diagram on the left, you'll see it comes 6 files to a pack. Okay. It's reciprocation. So the cost per pack is 36 bucks, $6 a file. If we look over at wave one, it comes 3 to a pack. Okay. So if you do the math breakdown, depending on how much you're buying, it's going to be about 18 to 24 bucks a piece. And it's a single use. If you go to Reciproc Blue, that comes again, depending how many you're buying, somewhere between 12 and 24 bucks a file. If you're using Edge, I guess Edge 1, I have no experience using it, but they're about 10 bucks a file. So, again, 30, 40% still more than the Biomed Avalon reciprocation. So to me, if we're comparing all 4 of those files and we're looking and saying, oh, well, Excalibur Pro is a cheaper file, it is a cheaper file, but it also has the best metallurgy to date and it has a nano coating to it. So you're getting high-end technology, you're getting a more efficient file, you're saving pericervical dentin, and you're getting it for a less price. And if you do the math, if you look at, paper points, the sealer, which I talked about, is a substantial savings if you're using bioceramic sealers. And so if you're doing 6 root canals a day and you're a full-time doc with 3 weeks off a year, you're saving about 17 grand at the end of the year. If you're doing 8 root canals a day, you're saving like 26,000. And so you can see how those numbers add up. And I think at the end of the day, that's something to think about. That's it's real money. And there's people out there, you may look at this lecture and say, thanks, it was great. I'm not going to change. I'm a typical rotary guy. And like I said, I am too. I still use Slim Shaper Pro is kind of my how I do my glide path into my kind of jump file to getting to Excalibur. Could I push Excalibur Pro right to do it? Probably could, but I'm not going to do it because for $6 to have a bridge file and make my life easier when I'm doing case after case after case, I don't want to deal with any type of separation. And I haven't had to. It's been a beautiful transition. And like I said, that Z Glider Evo, that middle file, that's the one I told you I use is when I get long, skinny calcified canals. It's just a great file to use. If you're more of a Pro Taper guy, Blue Shapers is their solution to that. They have a Blue Shaper Pro. The tip of that file has been altered. The apical 3 millimeters has a laser, making it much more sharper and aggressive. And again, that's going to be a little less taper than its counterpart from Pro Taper. And apical shapers, I don't use them. They're great files, but we can have someone else talk about that. So again, thank you, Mike and BJ, and I know Jason are here on the call. But again, you can come to them for anything you guys might need in terms of products or more detailed information. But they wanted me to share like my journey and my work with using these files, and I feel comfortable using Excalibur files now for 3 years. I'm very comfortable saying that, it is my primary file system, and I'm a guy that does root canals all day. So I hope it helped. I'm here for any questions you might have.
Thank you, Dr. Munaretto. We have a ton of questions, so thank you for the fast 47 minutes.
I
Giving
have
us
49, but okay.
what?
You said 50.
It is 49. You're exactly right. So, anyhow, let's get to the questions here. Thank you so much again.
Okay.
What percentage of cases do you use reciprocation in your practice?
I mean, probably 95. It's literally it's my main finishing file. For me, if I'm working on pretty much anything but an upper anterior, if I'm going to use my file system file is normally going to be a SlimShaper Pro ES1, ES2, and then I'm going right to Excalibur. And it just depends if I'm going to go to if I want that E20 or E25. You can go from a ES2 right to a E25. Okay, it can make that transition. You just have to take a couple more passes. It's not like I have to use the E20 first because that profile is going to get you there, but you may have to go and take more passes to get there. But that's pretty much what I use.
Fair enough. Kind of along those similar lines, how did you come to the conclusion of mixing rotary and reciprocation?
That's a great question. You know, probably because Wave 1 files are just so expensive. I mean, I pay my own overhead, right? So like when I first started using those files, they were literally $26 a piece. I remember Artie Smith telling me they're $26 a piece. So, my dad and my uncle were I was practicing with them at the time, and when they almost, their jaws hit the ground. And so I didn't want to use, we always told our doctors, like, well, don't use, if you're using the glider, okay, Wave 1 glider, gold, and then you're using a small and you're using a red, you're at $80 in 3 files. And so I think that part of my brain was like, okay, you only want to use one. And so I was always, but before I started using Bomb and Avalon files, back in those days, I'd make a glide path and then I would use a purple pro taper, right? That would be like my jump file, I would call it, to get me to using wave one. But I've always went from like a major hybrid technique of I've always used a hand file to establish a length. Okay. I used to go, like my dad always told me, if you always use a 15 to length, you always can get back. I don't use a 15 hand file to length anymore. I usually stop at a 10, but that's just because the metallurgy of the files is better nowadays. So I'm always going to kind of establish that length, and then I'm going to go to rotary, and then I'll finish with reciprocation. I could do the whole thing with reciprocation, like I showed you. Um, it's just, a lot of, like I said, for me, I don't like taking my head. I've been doing this long enough. where I have neck and back problems. And every time I have to look away, eyes at 51 are not eyes at 41. And if you're 41 right now, come talk to me when you're 51. But if you're working all day, 4 or 5 days a week, that eye fatigue is real. I'm under the microscope 100% of the time. So every time I have to look away to change a file, check my length, it's more of this, right? And this is where I get that neck pain right now. And I have a trigger point right here that bothers me. So it really, if I use one more file so I don't have to keep putting all that pressure on my single reciprocation file, it just makes it easier, I think.
Fair enough. And I see we have a bunch of 31-year-olds on the call too.
Yeah,
So,
I bet you do.
so thank you for those guys that are joining. How does the Excalibur feel versus Wave One Gold or Reciproc? Any challenges with the flexibility or pre-curve? You kind of
So
mentioned.
to me, the reciproc, when I use reciproc glue, I really felt like it wants to pull. I mean, it's a strong file, right? Um, I feel like it wants to grab. The Excalibur files, it's more, I guess it's like cutting with a sharper knife. It's a little more efficient. I don't put really any pressure on them. I mean, you're putting a little apical pressure, but it's not pulling you into the canal at all. So that I will tell you is a little bit of a difference. So if you use Reciproc, I think it does kind of grab a little bit, where Excalibur does not. I used Wave One so long that honestly I can barely remember not doing root canals with it. So I don't even remember what it was like when I first started using it. I just remember it being a pretty seamless transition. But going from, to jump to Excalibur from Wave One, it was super easy.
Fair enough. You mentioned in the, hopefully I say it right, Mariquin study, you're using 2 to 3 files to shape. Was that because of gentle wave or is it less for you now?
I I'm always going to go to the fact where I have to get irrigation down to length, right? So depending upon the length of the canal, and that's going to determine the shape, right? So I have to get a 30 gauge needle to within 2 millimeters of my working length, which would be ideally the apical constriction. We all know that the apical constriction is not uniform, and trying to define that, we could talk about that for hours. But I'm using it based off of electronic working length, right? So that's where I'm going to base that to. So depending upon my taper, if I'm using GenoWave, I might go to a nano taper. If I can keep something really small with using GenoWave, I will. But I probably use GenoWave. I'm more of like probably a 70-30, 70 with it, 30 without. Being around Chicago, we don't place our own cores and buildups, which if we did, I probably would do more GenoWave. But because we don't do that, sometimes it's just hard to build a platform and maintain that seal. And so when I'm not using GenoWave, that's when I'm almost always going to go to an E25, or maybe even go to a 30 tip on something, or go to an E35 so I can get my irrigation there. And like I said in that slide, if you're not irrigating the apical 1/3, that is where the game is won and lost. So, there's no excuse like I'm just going to prep smaller, and I'm just going to, whether that be a vital case, you're leaving vital tissue behind, or if it's a necrotic case, you're leaving bacteria behind. Either way, you've got to clean it out. And so you've got to get your irrigation there.
Perfect. How do you see the adaptation of the nano treatment from the old files? So nano Excalibur Pros from Excalibur Original.
The first time I used them, I can just tell you I mean, people say they cut like butter. It literally was like almost like going into, it's like almost like the file was hot, that it was quicker. I mean, it literally was just more efficient. It felt like it just went down the lane quicker. Maybe instead of using four, like going through with 2 or 3 pecking motions down, I could get it with, like you saw that one case there, that was just 3 to get it right to length. So again, it's just a little more efficient and a little bit faster.
Fair enough. This is a retreatment question. What do you use for retreatments? I've been hearing other companies tout their files for retreatments.
So I still remove the coronal gutta percha with heat. I still use a little bit of chloroform to remove gutta percha when I have to. So I use basically, there's some retreatment files. I use them at 850 to 900 RPM, so fast, pecking motion, letting them grab that gutta percha and pulling it out. But now what I've done is I've gone to using an Excalibur that I think will match that shape. Really not trying necessarily to alter the canal anatomy at that point, but just allowing it to go down there and pull the gutta percha out. And that I do put some pretty firm pressure on, because again, the file's not grabbing the walls. So I'll try to err on using a little bit smaller. What I want to do is I want it getting into the gutta percha itself to kind of grab it and to dislodge it.
Perfect. Question around the gutta percha. How does it fit your cases and what's your obturation technique?
So I use, you saw the sealer that I used. I already talked about that. So, but I've gone to using, I wouldn't say it's a straight single cone because I just don't sear it off at the orifice. I typically inject sealer if, depending on the anatomy, of course, there's like on upper molars or on any tooth where I know there's a large additional canal. I remember when, like I said, I talked about Kirk earlier, but Kirk Corey kind of pressed me into doing some non-instrumentation MB2 stuff. And, talking to guys like Dr. Hest and seeing people who are posting these cases where they're just using a bar broach and pulling pulp tissue out, or they're doing very minimal instrumentation. So using that with GenoWave, I started doing where like, yeah, I wouldn't even instrument some MB2s if I knew they met mid-root or in the apical
Mhm.
1/3. And then I would push sealer back through. So injecting sealer, using a paper point slowly to push that sealer back through the MB2, re-injecting, seating my cone, and then I'll usually still down pack 3 to 5 millimeters into the canal. I don't down pack as far and as hard as I used to, but I will do a slight down pack and then I'll backfill.
Do the cones fit pretty well?
Yeah.
Cool.
Yeah. And again, I think that's a problem with every single company. I've never, everyone's trying to get the cones to be ideal, but the bottom line is if you have an S-curved tooth and you think you're going to take an E20 to length and then you're going to seat an E20 cone to length, in my opinion, it can be very hard. A lot of times with that, I'm grabbing a 15 or a 20/04 cone, and that's going to be my master cone, loaded with bioceramics, though. I mean,
I know what you mean. So kind of along that same question. So when you showed a case with a E20 shape, does your advanced irrigation technique decide between an E20 or say an E25 for that reason?
yep, pretty much.